Hello, I'm Dr. Suddhasattwa Sen, Senior Consultant in Charge, GI Surgery, GI HPP Surgery, Oncosurgery and Laparoscopy in AMRI Dhakuria Hospital at the moment. The topic that I have been given is to discuss on when should a patient approach a doctor when he or she thinks that he is harboring a cancer inside. Now, my coverage would be on abdominal cancers, by which I mean the area which lies between the chest and between the two legs. The cancers normally that we deal with are the liver cancers, the bile duct, the gallbladder, the pancreas. It can be the esophagus, stomach, duodenum, which is called the upper GI, can be really from the spleen, small bowel, colon, rectum, anus. And sometimes, rarely, not very common, but still there can be tumors of the behind part of the abdomen, which is called the retropetal area. Now, there are some specific symptoms, there are some non-specific symptoms. Non-specific symptoms are like, when do you think that you may be having a problem? First is if you have multiple cancers or single cancer history in the family. 2, you have some genetic changes, you know that these are cancer prone. 3, you have some conditions like say Crohn's disease or gallbladder stones or some other issues which may be a cancer prone disease. When your age is more than 40 or 50, you are having some non-specific symptoms like persistent weight loss, persistent loss of appetite. You may be having specific symptoms like GI bleeding, that is rectal bleeding, increasing constipation, alteration of bowel habit, constipation, diarrhea alternating. You may be having a swelling in the abdomen, a definite tenderness in the abdomen, a lump in the abdomen. You may be having jaundice for hepatobiliary pancreatic system, this yellowish discoloration of the eyes and the urine. You may be having pain is relatively a very uncommon or a delayed or a later presentation of cancers. So mostly the cancers are painless. In upper GI, you may be having dysphagia, that is inability to swallow, maybe a painful swallowing. It may be a features of recurrent vomiting, a projectile vomiting, specifically for gastric obstruction, which may suggest a stomach cancer. A colon, right colon and a stomach cancer classically may present with unexplained weakness, with lot of anemia. You may have an occult blood positive on the stool test. So all these symptoms sum up that what I would like to say is, based on the organs you're going to have some symptoms, based on the underlying cancer you're going to have some non-specific symptoms. When do you go to a doctor is when you have these symptoms persistent beyond a certain period, say 2 weeks. Beyond 2 weeks you have treated yourself, but beyond 2 weeks the symptoms are persisting. Your age is higher. You're in a high risk group because of underlying conditions. You have family history of cancers. This is the time ideally you should go to a doctor. Which doctor should you go to? You should go to a doctor who's either a cancer specialist. If it's a GI problem, then go to a GI surgeon, go to a gastroenterologist. If it's a uro problem or a nephro problem, go to them. So based on the organ, you should choose your doctor. So in a nutshell, these are the things you need to be worried about when you think that you may need to rule out a cancer. That's very important. Thank you so much.